Female perineal care. Perineal care involves thorough cleansing of external genitalia and surrounding skin. Articles required: 1 basin, soap solution, wash clothes, 1 jug with warm water, a pair of clean gloves, 1 torch, 1 kidney tray, 1 Macintosh or a plastic sheet, a towel and a top sheet. Greet the patient. Explain the procedure to the patient and take consent. Provide privacy. Wash hands and wear clean gloves. Prepare water to be used for procedure. Test the temperature of water. Fold top linen down toward foot of bed and fold patient's gown above genital area. Position patient with knees bent and legs apart. Assess genitalia for signs of inflammation, skin breakdown, infection or contamination with fecal matter. If fecal matter is present, cleanse buttocks and anus, washing from front to back. Rinse and dry the area thoroughly. Change gloves if they are soiled. Place a Macintosh below the perineal area. Remove and discard the underpad. Place a towel below the perineal area. It is better to diamond drape the patient by placing the top sheet as shown. Retract labia majora from the thigh. Wash carefully in skin folds with soap and water from perineum to rectum on both sides using separate quarters of washcloth for each stroke. Rinse and dry the area thoroughly. With soap and water, wash the outer surface of labia majora on both sides. Rinse and dry. Separate labia minora. Clean the inside of labia majora, labia minora and vulva on both sides with soap and water. Rinse and dry the area thoroughly. Remove diamond drape. Replace Macintosh and towel. Place a new diaper as needed. Remove gloves. Place the patient in a comfortable position. Document the procedure and findings. This completes the procedure for perineal care in females. Points to remember. Always wash from the pubic area towards the rectum. If the patient has urinary or bowel incontinence, apply a thin layer of skin barrier containing petroleum jelly over the skin. Perineum should be cleaned after each act of urination and defecation. Clean from the cleanest to the less clean area. Hands should be cleaned after giving perineal care.